We'd just like to welcome you today to our webinar. It's about dynamic stability. We're excited to have Christine. And Christine, I'm so sorry, I don't know how to say your last name.
Oh, of course not. It's hard. So it's Ruoti.
Ruoti.
Right.
Anyway, so we're excited to have her here today. And I'm just going to read a little bio about Christine. She said, I call myself a movement educator. I work with all age groups of people on healthy aging by focusing on biomechanics. I emphasize preserving movement potential in the body so clients don't lose the ability to walk, sit, stand, climb stairs, or etc. I attended the University of Utah and hold a bachelor's and master's degree. I've been working with movement in some capacity for 30 years, specifically working as a movement educator. I work with people ranging from professional athletes to people who are unable to get out of bed. I specialize in realigning the body to return to what is called neutral, which is the position of greatest strength, power, and endurance. So we're really excited to have Christine here today. And like she mentioned, if you're willing to turn on your camera, she's going to be doing some practical practice with us, and that will really help her to give feedback and suggestions if she can see how you're doing. So if you're comfortable with that, you can go ahead and turn on your cameras. I'll
Great.
turn it over to you,
And
Christine.
no pressure. Yeah, no pressure, but if you're comfortable, that would be very helpful. How does it work normally, Marianne? If someone has a question, do they chime in or do we kind of wait till the end? Or is it
Either way,
different for
sometimes
each presentation?
yeah, sometimes people write it in the chat, and I'll be watching the chat for questions that might come up there.
Okay.
We also tell people if it's okay with you that they can just unmute themselves and ask a question at any time. So
Exactly. That's what I was going to suggest, especially as it pertains to what I'm talking about in the moment. And then if there's general questions or even personal questions about your own situation, everyone, if you have a question, think I might be able to help, then we can save those for the end. And I would make myself available to all of you for personal help after this session. I have some extra time, or I'm happy to have Marianne share my email, even my phone number, and you can reach out with personal needs. I would be completely fine with that, Marianne. Okay, let me just say one thing kind of procedurally. I am hooked up through my iPad through a Miracast system to a really large TV. And so that's where I prefer to look at because I get a broader view, a larger view of people. So I'm looking at that TV right now. If it appears I'm not looking at you, I actually am. I'm just looking at a bigger representation of you. So I believe Erica or Marianne sent you a request to have a ball around the size of a tennis ball, a chair or a countertop or cabinet somewhere where you could hold on to when we stand or when we do some of these balance challenges. And also, I didn't think of this earlier, but if you have a chair, most everything that we're going to do could be done from a seated position if that's more comfortable for you. And of course, my highest priority for everybody is to remain safe. So if you're, I'm sure we have a variety of different fitness levels and just stability challenges. Number one priority, please keep safe. So it's my understanding that you've been talking this month about balance and having different sort of different information, different presentations presented to you weekly. When asked for a title of my presentation, I wanted to talk to you about what I call dynamic stability. I think the word dynamic is pretty self-evident. Dynamic meaning movement involved versus a static stability, like if you are sitting on a chair or the cabinet that you're going to use for balance, that's a static object. That doesn't respond to environmental changes. You put your groceries on your cabinet and it doesn't buckle. The wind blows outside your house and the chair and the cabinet stay. Our bodies are not like that. Our bodies are put together with a variety of different types of joints, and through those joints, and we'll talk about joints in a moment, but through those joints, there's movement. And that movement is absolutely essential and required for our stability. I think this is not known to a lot of people that in order to be stable, there must be some movement. I believe that a lot of what is taught or how this information that we can come across is interpreted is stable is the absence of any kind of motion at all, almost statue-like, and that means you were stable. And I think it's very empowering and also very forgiving to for you to uh, believe and experience the fact that actually we're more stable when there's motion. So let's define motion. I think most of us have an idea of motion as something large. So if I lift my arm, there's no doubt that's movement or motion in my arm. The movement, the motion that's required for dynamic stability is much more subtle than that. So for my clients, I use words like um, wobble or a little bit of a bobble or a wave. Sometimes in my mind, I'm very visual. So I see like under the ocean, if you've ever snorkeled or scuba dived, you could see a little bit of the seagrass just kind of move against the current in the ocean. So when I say movement and when I ask for you to feel movement on certain parts of your body while we're trying to stabilize, please don't think something large, like a large motion of your arms. Think more of a wave or just a little kind of wobble. And whatever words come to your mind, great, go with them. Okay, the words I give you are just suggestions. Okay, so it's my argument that we need to have some movement available in order to stay stable. How does this happen? Previously, just a few seconds ago, I said through joints. And Marianne, I forgot to ask you in the beginning, is there a way for me to share some images that I have on my iPad, or would I have needed to bring those to you beforehand? So for our experience lab, the first thing I want to introduce you to in terms of movement that is necessary for our stability are our feet. And this is just a simple rendering of the bones of the feet. So let's talk about what is a joint actually. A joint is where two bones meet, where two bones come together. There's usually there should be, and it's hopefully the case, or there's a presence of articular cartilage or some cushion against the joints so to allow for movement that's not painful. On Zoom, I can kind of point out some things I can draw. I'm not sure if I can do that here, but I think it's pretty self-evident that where the joints are here, where the dark lines, some of them are vertical, some of them are horizontal, some are more rounded. Each one of those dark lines represents where two bones come together. So the feet are just ripe with potential for little bobbles, little ebbs and flows, little waves of movement that is very necessary for our stability. Okay, how to get out of here so I can see you again. Stop sharing. All right, got it. Okay, now let's take the ball that you brought, and please know this can be done standing or this can be done seated. And we're going to bring those joints to life so that they can help you move. I'm going to pick up my camera so that I can stand and you can see my feet. Please feel free to stay seated if that's better for you. So let's all do the same foot. Put your ball on the ground and either stand with a hand on your cabinet or sit down, and let's put your ball under the right foot. And let's imagine that we're trying to change the shape of the ball. Okay, so we're putting body weight on the ball. The ball is trapped between your floor and your foot. Now, if your tennis ball is new or hasn't been used much, this might be a little bit firm. If you find that this works, I call this rolling out, or its technical term is myofascial release. If you find that this works nicely for you, I can suggest some balls that will be more comfortable when you roll than a hard tennis ball. So what we're doing here is warming up the muscles, increasing blood flow, increasing water flow to what's called fascia tissue. It's a soft tissue component, very plentiful in our body, and that will allow the bones of the feet to react or respond to the motion that you're doing and allow you to stay stable. Okay, let's go ahead and place the ball right below the toes. Let me know if you can't see me well. I'm going to turn my body to the side. This is called the ball of the foot or the pad of the foot, and it's just lower than your toes. Put some pressure on that part of your foot and let it up. If you have been told you have plantar fasciitis, this is a wonderful healing exercise for that. So I'm putting pressure on and I'm letting pressure up. And you can imagine like we're squeezing a sponge, and that's increasing the blood flow to muscle and water flow to, like I said, what we call fascia tissue. Okay, let's put the
Christine,
ball
I have a
at what we call the
question.
arch. Someone has a question?
I do, yeah.
Great.
So when I'm watching you, it
Okay.
seems that you're rocking rather than just moving the lower part of your leg. It looks like you're using your whole body.
I was a moment ago at the ball at the just below the toes. I was putting pressure on by rocking and then taking pressure off. Exactly.
And in the first one, I thought you were doing that as well, but
Oh,
no.
I was more rolling, but yeah, my body was going with it a little bit. So this is, I'm back to doing the first exercise so that I could keep some body weight on the ball. Yeah, good eye. The first one was less rocking. The second one was more. Does that answer your question? Great, I can see you. Great. Let's put the ball at the arch, and now we'll just sustain this pressure. So put a little body weight on it. Do your best not to lock out your knee, okay, to have a little softness to the knee. And please, you're getting a good benefit from this if you're doing this seated as well. By the way, doing this standing is in of itself a balance challenge for a lot of us. So we're sustaining the pressure here. Now let's move our heel to the ball, okay? And we'll sustain the pressure on the heel as well. For all of these movements, we want to refrain from having the ball out in front of us. We want to have the ball and our foot pretty much directly under our center of gravity. Okay, so when we step off, let's step off the ball. Make sure you know where the ball is so you don't accidentally step on it. And now if you did this seated and you're able to stand and join us standing, we won't be moving much. So you'll have a better chance to feel the difference in your right foot. Ways that people describe the difference in how they feel after doing a rollout, or more technically termed myofascial release. The arch of the foot feels higher. The toes might feel more grounded. If your toes feel more grounded, you're definitely more stable. Your toes are like 5 little kickstands to hold up a bike. Okay, the kickstands of our toes hold up the entirety of our body. Now, through the release, through the warming of the tissue, when we move an arm, move our head, something like that, we will have more access to feel the motion required in a dynamic stability moment. So let's do that. If you think you're okay to stand and raise an arm, then stay standing. If you'd like to return to seated, go ahead. So let's raise the same arm as foot you just rolled out. Lift the weight of the arm and lower it down. And let's do that a couple more times and see if you can't feel your right foot. If I were to dance it, I'd kind of dance it like this. A little tiny, subtle wave of energy, of load, the load of your arm going over all those individual bones of the foot. By contrast, we haven't rolled and warmed the tissue on the left foot. Raise your left arm and see if that left foot isn't stiffer underneath you. We haven't rolled this one. And notice Does anyone notice your arm, your left arm is heavier because you haven't rolled your foot? It's a whole other presentation on the interconnection of our whole body. I'd love to know. I can see a few of your faces. Can you give me a thumbs up if you felt any of the motion? Thanks, Vicki. Did you feel the motion on your foot? Thank you. How about the arm? Did anyone feel their right arm came up easier than their left? Awesome. Isn't that fascinating? Okay, let's try the left foot. So we roll. This work is a passion of mine, all of this work, but especially this myofascia release work or this rollouts. I often call them kind of to use less technical. So Vicki, like you said, you noticed the good eye that there's some motion forward and back here. You're right. Okay, and at the same time, the ball rolls to the toes and to the heels. We are, again, warming the tissues, but we're also neurologically connecting with a set of specialty nerves called proprioceptors that speak to our brain about our position. Okay, that's the value of joints, the value of understanding your joints. Proprioception lives there. What is proprioception? Proprioception is a Latin word for one's own. So your proprioceptors speak to you about your own position, your own state of you. Are you about to fall forward? Are you leaning to one side? Are you safe? Those are communications that our proprioceptors give to us. And believe it or not, we have a ton of them on the bottom of our feet. Seems so far away from our brain, but that's why we have quantitatively rich amount on the bottom of our feet. The feet are far away from the brain. Okay, put the ball at your ball. So even without the raising of the arms, oh, sorry, this is called the ball of the foot. So just below your toes, and we'll start the rocking. We'll put some pressure on and pressure off. Even if all you do is roll, massage the bottoms of your feet, you will be increasing your balance because you're alivening and waking up your proprioceptors on the bottom of your feet. They're throughout our whole body. Why do we need to wake them up? Because we stick them in shoes and we put them under a desk. Okay, so they don't get a lot of communication when we do that. All
So I have
right.
another question.
You bet.
How hard should you be pressing?
Oh, that is such a great question. You should not have any appreciable discomfort. If you feel like you're getting a medium tension massage, that's what I would go for. It's not about digging the ball in to your tissues, digging it in as deep as possible. Any obvious signs of extreme discomfort like nausea, dizziness, feeling like you might pass out, that's too hard. But I would expect to feel, I call it a response from those tissues. So I wouldn't expect that you wouldn't feel anything. That was a terribly constructed sentence, but not so much that you can't wait for it to be over. Okay, put the ball at your arch now, and we'll sustain that pressure at the arch. Imagine if your arches drop. We call that flat feet, or you might say, ever since I was a certain age, I had to buy a wider shoe. Your feet didn't magically get wider, your arches fell. They pulled to the pull, they succumbed to the pull of gravity. So the bottom of your foot started to ooze out the side. If you don't have arches, the joints of your feet will not wave as they should. You can bring back your arches. You can with this work and with proper strength training. People who are born with flat feet can also create arches. I was born with flat feet, and through dance, I developed arches enough to dance professionally. Okay, put the ball at your heel, and if you need to step forward, you want to have sustained pressure.
I'm
Did
sorry.
you lose? That's okay. Did you lose your ball?
I-
Sometimes they roll away.
No, I squished it.
Oh,
So
oh, it broke. Did it break?
I have to get a harder ball. I apologize. I'll go
No,
mute.
no, that can happen. And the ball can, balls roll sometimes. Okay, go ahead and step off. Now, our left foot, that sense of lift, the authoritative press against the floor of your toes, acting like kickstands, should be more apparent and more symmetric to what you felt on the right. Now, let's raise our left arm and notice if that left foot has more of a wave or a flow to it than it did when we lifted it prior to rolling. Not only that, notice if your left arm comes up easier. Just fascinating fact about us. Okay, so this is what I mean by dynamic stability. The movement of your feet as you raise your arm. Let's say, how does this relate to your world? Getting something out of the cupboard, reaching up to fix a picture that might be crooked. If you have stacking washer and dryer, putting something or taking something out of the dryer, all of that raising of the arms requires the ebb and flow of the bones of your feet for you to stay balanced. If you grip your feet, if you grip your muscles, you'll actually be less stable. And I think that's the good news, because when I work with clients and they presented somewhere for balance help, the whole idea that's pushed is strength, strength, and strength. And it actually has a lot more to do with your adaptability than it does to do with your brute strength. And I happen to think that's really good news. Now, our next experience, I would like for you to be able to close your eyes. So two things I suggest: either make sure you have a hand on something that will keep you stable, or sit down. You're still going to be able to feel the effects of this. This really is probably the most accessible way to have you feel this idea of movement to keep stable. And in retrospect, I should have had you do this first. Okay, so make sure you have a hold of something or you're seated, and I'm going to have you just very gently and slowly close your eyes. Notice your body sway. Don't judge it, just notice it. And after it sways for a moment, you should come to rest pretty stable. You will never be static because you're living, breathing person. You're breathing, your heart is pumping, your blood is flowing. Okay, go ahead and slowly open your eyes. And did you feel that sway when you shut your eyes? Anyone? Okay, that again is an example of that dynamic stability. We should not expect that you could close your eyes or raise your arms and have zero motion in your body. That is an unreasonable expectation based on the fact that we are full of joints, of little bones that move against each other. And so I hate for people to feel unstable because they're not rigid. Okay, and in actuality, rigidity will decrease our stability. I showed you an image of joints of the feet. We have joints everywhere in our body. Anywhere that we have movement potential, there are joints. And so I can show you more pictures and we can access more of those joints for our stability. So the next exercise would be best done seated. So pick up your ball and go to where you can sit. Let me pick up my camera and move it again. And then I hope I remember how to share again. I'm very uncomfortable with technology. So having a new platform was a little bit scary, but hey, I'm just gonna jump in, and please help me, Marianne, if I need it. So I'm gonna push share and it's not responding. How come? Oh, Marianne, it's not responding when I push share.
Just keep trying. I don't know.
Okay, push
Everyone,
again, please. I mean, I can do it without, I really can, but it's nice to have it. I don't know. Let me see. Nothing is happening when I push. Let me push like mute and see if it'll mute me. Nope, none of my buttons are working, or none of my icons are working. So it's okay. But let's look next at the knee joint. And I need to lower my camera. So knee joints can definitely cause people can feel pain here, so they can avoid moving them. If you have pain in your knee, this next rollout will be a fabulous thing to care for your knee, medicate your knee other than with pharmaceuticals, and also will grant you more stability. So take a ball and let's put it under your right knee. So it is resting right in the empty space behind your knee. My foot and my lower leg are reaching for the floor. So if you have to scoot forward on your chair to have your foot touch, that would be, I would like you to do that. And all we're doing here by letting the ball sit there is we're encouraging an empty space, a concave curve behind the knee. That is how our knee should sit. Okay, we shouldn't have flatness to the back of the knee. That's not a stable or healthy position for the ligaments and soft tissues of the knee. Now you can't see my foot, but I'm going to turn my foot out and turn my foot in. Can you see just my ankle? And I get that it's a little hard because what I'm sitting on is dark gray and then my pants are black. So if I do my hand and my arm, this is what I'm doing with my foot. So when we bend our knee, our upper leg bone goes one way forward and our lower leg bones go another way backward. If that doesn't happen, we're not going to be able to sit down without falling into a chair. Have you had the experience of falling into a chair or been with someone who sits gets close to the chair, but then knees won't bend anymore, feet won't move anymore, and they have to drop into the seat? That's not a stable situation. This will help. So will what we just did with our feet. Okay, now let's stand up right in front of that chair you were just sitting on. And I realize you can just see my pelvis and my legs, but that'll work. Now, first of all, see if you can't notice a difference. We have done both feet and now one back of knee. The knee of the knee that you just rolled out, that kneecap, or technical term patella, should be sitting more forward and feel lighter and a little bit looser just in the standing position. Now let's attempt to sit back down and see if you don't have more movement available to you in that knee that you just rolled out. And then go ahead and stand back up. Now see if you can't notice the connection between your feet as well. So the advent of the release around the right knee, plus in combination with the right foot being rolled out and the movement there, when you sit down, your right side of your whole body should sit down lighter and with more freedom than the left. Okay, let's do the left side. So knee joint, it's where your upper leg bone and your lower leg bones plus your patella or your kneecap meet. And there's supposed to be lots of movement potential there in order to keep us stable. Go ahead and turn your leg out and in. So if I do it with my hand, so you're sure to follow.
Christine, is
Out
there
and
a
in.
way that you could do that on a chair so that you're sideways?
Sideways? Yeah.
I don't know how far back you're putting that ball.
Oh, good. Okay. Forgive the noise. I do have a chair in here. It is on rollers, which is the only sort of precarious thing. I'm going to pick up my camera and move it. And then let's see if this works out better for you visually. So I get you. I hear what you're saying. So if I'm sideways on a chair, the back, it's right behind your kneecap, if that's helpful. Okay, the firmness of your kneecap, the ball goes right underneath. If I were to stand up and turn my back to you, well, my pants are probably a little baggy, but it's the indent behind the knees. Now, some of you could be confused also because you don't have indents. A lot of people don't have indents. I have to really work at having indents. That's, if you've ever heard the expression hyperextension, that would be hyperextension of the knee. This movement series will help you find the back of your knee, make it more concave. Does that help?
I think
If I
so.
move my pants up too. Now my foot, because I'm short, is not really touching the floor as I would hope it would. But facing sideways, I can't have my foot on the floor. Okay, so get your foot on the floor and hold it there, and the tissue will curve. The way our tissue works, it'll take on the shape of what's pushing against it. That's food for thought. That is a whole other topic too. But we're curving the tissue over the ball.
Why
And
does the
so when
foot
we,
need to be, why does the foot need to be on the floor?
for weight distribution, it's going to be a lot more comfortable and more effective for the tissues behind the knee if the weight of your lower leg isn't just dangling on the ball.
I
Turn your
also
leg.
wanted to remind you, Vicky, if you haven't already, or whoever, if you can't see Christine big, you can make the layout so she's the
Oh,
only one on your screen.
yeah, no, I did
You all
that
know how to do that?
already. Yeah,
Okay, perfect.
Okay,
I'm gonna need another chair because my chair doesn't allow
you to
for
put
me
the
to
ball
go.
and have your foot on the floor. Do you
Right.
have something you could put under your feet? Let me give you an example because I have something in my room. So I have this box that I keep some paperwork in. I could put that on the floor, put my foot on that, and then, I mean, I'm pretty short, but pretty much there. It'd be more ideal if I had more weight on my left foot, but this'll do. So if you have something, a stool,
Yeah, my issue is that my chair is short from my bottom of my rear end to my knees.
right, yeah,
I only
that's
can
the
get like
issue
three.
I'm having
Yeah.
a little bit
So,
too. Well, that and really short legs. Okay, let's start the turning out. Now, please don't think you won't get any benefit if your foot is dangling. I would say rather than miss the material, just go ahead and let the foot dangle. You will still get some benefit. Okay, so within our joints, I started to talk about this. You've heard of things like cartilage, probably, especially as it relates to knees. You've heard of terms like ACL, meniscus, MCL, PCL, things that people injure. Those are ligaments, the ACL, PCL. Meniscus is like a cartilaginous sort of cushion, kind of like the tip of your nose. All of those are ripe with nerves that send information about our position. So before we lose our balance, it is possible, especially if these joints are well maintained and we're aware, it's possible that we get communication prior to ever losing our balance in such a way that we can't recover from and we fall. Okay, now let's go ahead and take that ball away. Let's stand up and then we can see and feel how that left knee feels. There could be more emptiness behind the knee, especially if you're a person like me who sits in the back of your knee. You might even not know that you're that person. If you haven't done body work before, you might not know that. It's just normal. But if you are, that'll feel, your kneecap will feel more forward. Now, as you go to sit, make sure that your chair is there. That should feel so much more freed up the knee to move. And notice the connection to your feet. Okay, there's a ebb and flow over the feet as well. So no joint exists without other joints. Okay, the way we've learned about our body in the past implies that the knee joint is separate from the other joints. That is absolutely not the way that it works. Okay, is anyone finding it a little more fluid to go down and up, sitting and standing? You can say no too. You don't have to say yes. I mean, I'd love it if you said yes, but you can say no. Okay, now if we can, if you're comfortable standing, and especially if you have something to hold on to, back of a chair that doesn't have rollers, a cabinet, let's think about the hip socket. Again, if I could make this work, I'm going to lift my camera. I would show you a picture. I'll try again, just as in case something happened. Oops, something changed. Yeah, I don't know. Oh, you know what? Let me try that. That's it. So I was getting a message and I was ignoring it, and that's why I couldn't show. Okay, so let me show you the knee joint, what we just did. Okay, so this can be confusing. Look at the left, or can you see where it's the very left image? Can you see where it says femur? That's your thigh bone, what you call the thigh bone. The thigh bone gets wider at the bottom into those little round bones. You can see the kind of teardrop shape right in the middle, and it's labeled patella. That's what we call the kneecap. And then below that, where it says tibia, that's your main shin bone, the biggest one, the one that hurts when you run into a cabinet or something. And then if you look to the left, there's a smaller bone, and that's called the fibula. That's the one that gets broken the most when people sort of roll sideways over their ankle, because that one is so much thinner. You can see kind of the purpley gray material on the bottom of the femur, top of the tibia, or excuse me, bottom of the femur. That's cartilage. Okay, cartilage is there so that you can move your bones against each other in a way that is very slippery. Cartilage, articular cartilage, is 10 times more slippery than ice skates on ice. I'm not sure how the researchers came up and tested that, but that's the information that I learned. So it's designed to be very slippery and help us move. Now, if you look at the top of the tibia and there's some white little cushions, that's what's called menisci, because we have two. Each one is a meniscus. Okay, so when you move, if you look at the middle image, picture that femur. When you bend your knees, the femur is going backwards and the tibia is going forward. The kneecap is also moving upward. When you straighten your knee, the kneecap moves downward and the femur and the tibia move together. If you can make that happen along with the motion of your feet that we just felt, you're going to be very stable sitting down and standing up. It's the lack of movement that causes the problem. Okay, while I have figured this out, any questions? I think I saw someone had a hand raised. No? Maybe it was an accident? Okay, I was getting that message. Okay, let me show you the hip socket. That will be germane to what we're going to talk about next. Okay, what you're looking at here is the front of a pelvis. That's the heart-shaped bone. It's labeled on the right, pelvis. And then if you look below the pelvis, if you can look at the purpley bluish balls, those are called, well, it's labeled head of the femur. It gets the label head because it's round, like our skulls are round. In order that you sit down, in addition to everything else we've talked about, and stand up, that ball actually spins backward in that socket. It sits in a pocket, sits in a socket. In order for you to stand up, that ball rolls forward. Okay, so there's motion required in your hip socket, it's called, in order for you to sit down without falling down, and in order for you to stand up without having to lean on a table or twist your spine and push yourself off the chair. So let's try to feel that ball, or that it's called the femur head, but they've labeled it here, head of the femur, or femoral head to be more exact. If we can feel that rolling. Okay, I'm going to stop the share, pick up your ball, and let's imitate how the femur head rolls. So if you pick up your ball, and I think maybe I should turn sideways again, and cup it in your hand, pick up your other hand and roll that ball backward. That's what happens when you bend your knees, or sit down. When you stand up, that ball rolls forward. And it's more of like a spin, backward and forward. Does it help if I have my hand sideways? I'm trying to keep my hand out of the view. Okay, so if this doesn't happen, if this movement isn't there, that's when people bend their knees, and I don't want to just drop onto this chair because it's on rollers, but is everyone familiar with what I'm talking about? That kind of falling into the chair. And then if the femur head, if this ball doesn't roll forward to stand up, that creates the need for people to have something to hold on to. Have you seen people in your world kind of create momentum and then stand up, and they're usually twisted, and then we run the risk of injury on the spine or pelvis, shoulders. Okay, so this movement is required for your pelvis to be stable. So let's see if we can just get a sense of that. So stand up if you can, sit down if you prefer, and if you're standing, just out of an abundance of caution, put your hand on something or two hands. Let's bring our feet almost touching, but not quite. Pick up your right leg and bend it like you're marching. And where is the socket? I should have told you that sooner. It's right here in the front. So the ball is rolling backward as I pick up my leg. The ball is rolling backward in order that I pick up my leg and can keep my balance on my left leg. If this ball doesn't roll, the weight of my leg is going to pull me forward. In order that my leg, the weight of my leg get absorbed in my hip socket, that ball has to roll backward. In order to bring your leg down, the ball has to roll forward. And if that occurs, the weight of your leg is soaked up by the hip socket, and it won't pull you around and pull you off balance. Go ahead and put that right foot down, and let's try the left. So a number of things can interfere with any of these movements that I've been talking about. Now, if you're sitting, you'll be seated and you'll pick up your leg most likely less high, and that's just fine. Don't pick it up so high that it causes tension. Okay, so what does this relate to? Climbing stairs, right? One leg, getting in and out of your car. There's a lot of work. Walking that requires being able to balance on one leg and the other leg coming off the floor. Let's make it a little bit more functional, or a little bit more like what we see in real life. Pick up the right, put it down, pick up the left. And as you do so, let's hearken back to what we've talked about before. Can you feel the movement of the bones of your feet? Can you feel and imagine the motion that we label bending the knee and straightening the knee? And all of that is made better by the movement of this ball in our hip socket. So I wasn't sure if I would have time, but I really wanted to point out that every joint moves in the context of adjacent joints, and when they all move, you're going to be a better mover, and you're going to be a lot more stable. Okay, yeah, I was told to save like 15 minutes. at the end for questions, so we can do that now. Let
Okay.
me maybe just, I was thinking maybe I would just wrap up real quick and synthesize, make sure I achieved my goals.
My
And then I'll
question
take your
was in
question.
regards to that particular
Oh,
exercise we were just
excellent.
doing.
Okay, let's hear it.
So when I was standing and lifting my leg, I noticed my pelvis tilting back and my shoulders wanted to compensate by, I was kind of like my torso was curling in order to accommodate the lift of my knee. And I'm
Right.
wondering if I should be resisting that, which tells me my core is too weak, or if that's part of the wave that you're talking about.
Okay, what an excellent question. So let me answer the last question first. No, that's not part of the wave I'm talking about. That is extra movement that isn't helping, and it's in fact harming in several ways. So I love what you said. Should I be resisting that? And the answer is yes. Now, how to resist that in a way that's most advantageous? It could be a long discussion, but let me give you some pointers for that. That is a great observation. So let me stand and show kind of what I think you're talking about. And that is actually common. So you're lifting your leg and the pelvis is going with it. Yeah, am I getting it? And then the shoulders are moving and maybe the shoulders lift up because your body's feeling out of balance.
I'm getting more of an arch in the back, so the
Okay,
pelvis
so
is going
like
to go back. Yeah,
backward. Okay.
and so,
Either
but I
one
was
of those
going
two
forward with
things.
it.
Yeah, either one of those two things. Those are called compensations or less formal go arounds. So that tells you something in your hip socket, the ball isn't rolling, or maybe the hip socket is less some of its cushion. So your brain doesn't want the ball to roll where the cushion is not there because it knows it will be painful. Or were you perhaps trying to lift your leg really high?
I think I tend to be more flexible with all
Mm-hmm.
the muscles on the front, like the hips and the quads, and then less flexible in the back. And so I think it
Okay.
might be a compensation for something like that.
Okay.
I'm
So,
a huncher, bad posture, that sort of thing. So everything comes forward.
okay. You know, everything coming forward is not your fault. Everyone's falling forward. Look around at the grocery stores. We live under the pull of gravity. That's number one, right? Gravity is constantly pulling us down, which is a good thing. So we're not floating away. But the bulk of our body weight is in the front of us. Our spine is in the back of us. The bones of our face are way forward of our spine. The bulk of the weight of our skull is way forward of our spine. Our rib cage bows out forward from the spine, whereas in the back, the ribs are tied in against the spine. Within the rib cage, we have organs, okay? Our life affirming organs live there. They weigh something. Our pelvis is front of the spine, and our digestive and reproductive organs are out in front of the pelvis. So there's a lot of weight pulling us forward, plus coupled with gravity, plus coupled with or tripled with Steve Jobs. Okay, the iPhone, computers, we all just kind of fell forward then. So if you find yourself falling forward, there's good reason for it, but it doesn't mean you have to give into it. But how to resist that? Number one thing I would suggest to you is only lift your leg as high as you can without arching, in your case, the pelvis. If you're a person who tucked their pelvis or raised the shoulders or dropped the rib cage, whatever it is that you did outside of a vertical posture, stop just before that line. And then as you practice more, you'll find that you'll be able to lift your leg a little bit higher each.
That suggestion totally worked. If I don't
Oh, good.
raise my knee as high, I'm not resorting to the curling in order to get my knee 90 degrees from the floor, my thigh bone 90 degrees.
Excellent. Now, if you think about it, Why do we want to go higher? Like being a former dancer, oh my gosh, that's my impulse every second of every day. Higher, bigger, that's got to be better. We live in the land of bigger is better anyway, right? More is better, bigger is better. But if you think about it, how high do you need to lift your leg as for a functional movement? As high as your stairs are, um, as high as your bed is, right? To climb up into bed. There's no value in lifting your leg this high in a normal world, right? This is not how we climb stairs. So cut yourself some slack that way. What I teach is functional, how to live, how to do what you need to do to live a life feeling good, which doesn't mean your knee has to come up 90 even or past 90. Okay, great question. Any other questions? Any other ideas? I was just going to wrap up. Again, the idea that being static, being robotic is not the best way to achieve stability. Why? It isn't how our body is designed. We aren't fused, our bones are not fused together. We're breathing, our heart is pumping, lymph fluid is pumping through us, fluid volume is pumping through us. We're moving under the skin at all times. Therefore, too, we have a bunch of joints in the body, and therefore little movement is required to keep us stable. If you're feeling unstable, in the world we live in today, where we do a lot of sitting, we wear a lot of shoes, we hunker over computers, especially right in a pandemic, a lot of the places in us that are supposed to move are not moving. And that not moving makes us feel stiff, and has a lot to do with your stability. Do not think, please, that you're weak, that you have poor posture. I mean, you could be those things too, but it isn't all about that. We want to check our stability. I would challenge you to pick up your groceries, to change your laundry, and notice the ebbs and flows that go through your body, and do not judge them as you lost your balance. The ebbs and flows are exactly what is there for you to keep your balance. I think I'm clear, but I've made it clear. But please ask me questions, or ask me to finesse that argument a little bit if you want.
This is Vicki, and I don't necessarily need that argument finessed. What I'd be
Okay.
interested in is taking advantage of your expertise to talk a little bit about locking your knees.
Okay.
I tend to lock my knees when I'm doing like the tree pose in yoga as an example. And everybody says quit locking your knees,
Yes.
but when I bend my knees, I fall over.
Okay. Yeah. Everyone says don't lock your knees, but no one tells you how not to lock your knees. Am I right? Yeah. How do you not lock your knees? Especially if you're genetically, or you've trained your joint to accommodate a locking knee. So if you were a dancer, if you were a gymnast, if you were a skater, chances are you lock your knees, or more technical term, hyperextend your knees. So how do you not lock your knees? The solution is not the opposite, is not bend your knees. Okay, that just causes other issues. I have two ways of telling people with the most success of how not to lock your knees. Number one is a relationship of body weight. And I think I'll just stand here. Can you see my feet pretty well? I'm going to tighten up my pants. So all the years I spent as a dancer, I refuse to wear tight clothes now. But sometimes that interferes with my teaching. So I'm going to tighten my pants as much as I can. I'm a complete knee locker. Okay, this is what you look like, Vicki, likely.
Yes.
The
Yes,
backs
it
of the
is.
knees are flat, and your lower legs, tibia fibulas, are behind your upper leg, your femur. Okay, this is
Yes.
tremendous stress on your knees, and it's not your best position of balance. Your knee can't absorb or shock absorb for your balance when you walk, when you move your arms, when you do your daily tasks. So how do you not do that? Everyone's response is to bend the knees. The number one thing I can tell you is the weight distribution over your feet should be as follows. 2/3 of the body weight forward of your ankle bone and 1/3 of the body weight behind it. What am I referring to when I say ankle? I'm referring to what people think as their ankle, the bones that stick out on the inside and outside. Anatomically, that isn't your ankle, but that's what I think most people think of as the ankle. So
Okay.
when you lock your knees or hyperextend your knees, can you see that I have much more than 1/3 of my body weight at my heel?
Yes.
Right. So if you shift your body weight to 2/3 of it forward of the ankle, that'll put it on, this is called the forefoot, the arch,
Oh,
the ball, and the toes. That is number one. Okay, and then you'll shift the tibia fibula or the lower leg bones forward instead of backward, and you won't have to bend your knees. The second thing I tell my clients is lift the pelvic floor. Do you know what the pelvic floor is? Again, this is like this could be a whole other topic. The bottom of our pelvis, the muscles that we're told by our OBs stop the flow of urine. In reality, they're much bigger than how that feels. If you do this with your hands, this is the size of our pelvic floors. Our pelvic floor muscles are relative to the size of our hands. So if you lift, if you tone, and gosh, like I said, this could take a long time to really teach you how to do this properly. But if you can tone the pelvic floor, that will encourage a little bit of body weight forward. And that will take you off the back of your knees. So two things, 2/3 of your body weight forward of your ankle and a bottom up lift of the pelvic floor. And I'm doing that now, and I can't force my knees back. Can you see that I'm not hyperextended? And I'm trying, right now I'm trying to shove my knees and I can't.
Okay.
So that's how.
Okay. Thank you.
Always ask your teachers that. If they say don't do something or do something, how? It's my job to teach you how.
Thank you.
All right.
Yeah,
Thank you,
you bet.
Christine.
Thank
Yeah.
you for your
Unfortunately,
involvement.
we are at the hour
Yeah.
mark. So
Okay,
Oh, wow.
we really
sounds
want to
good.
thank you for coming and all the great information.
Absolutely, my pleasure. Please, I don't know if there's any way for students to give you feedback. I always want to improve myself. So if you get any feedback with any suggestions or positive as well, I'd love to hear it so I can keep doing what people like and stop doing what people don't. And then feel free to share my contact information if anybody needs my help.
Okay, yeah.
Okay.
So I have Christine's
Thank you.
contact if anyone needs it. There is a comment in the chat I'll read to you, Christine. It says, I have to get back to work, but I learned so much from this short demonstration. I look forward to observing my balance in the next few days as I move. I plan to add simple but not overdone joint movements a couple of times per day to see how that improves my balance. Thank you so much.
Excellent.
So
that is a good plan of action. Yeah. Excellent.
So,
okay.
thank you for joining us today.
Thank you. My
and
pleasure.
You all have a good day.
Yes, you as well. Thanks, everybody.